Today on Cancer Buzz, the future of the patient experience. I'm your host, Summer Johnson. Cancer programs are always looking for new ways to get important information to patients in a timely manner. Our guest today is here to give us some new ideas for improved patient-provider communication. Jessica Turgon is a partner with ECG Management Consultants and lead of the oncology consulting practice.
Within the last several years, the speed of just everything that we do in our normal lives have impacted healthcare. And so for a cancer patient who is waiting to receive a diagnosis or looking for more information about a scan, they feel that they would have access, just like one has on their phone, to the information as soon as possible. And so what we've seen, particularly coming out of COVID, is much more of a consumerism in cancer care. We've seen that people want their information quickly and even more rapidly than a healthcare team can turn it around. And they want it in a way that they can easily access it. So through an electronic medical record or through an online notification, something that keeps them engaged in their cancer care.
What are the 4 pillars for creating a different patient experience?
We feel that to really create a differentiated patient experience, one needs to think about the patient access and navigation, how one brings a patient into the healthcare setting, into your cancer care setting, if that's going to be through a digital platform, if it's going to be through the phone and talking with an expert, or if it's going to be with someone that meets them and greets them when they first come into a cancer center. We see that patients are really being navigated through their care continuum and being linked to an expert in their cancer care to help them coordinate care. So the outside of access, the second tier is then patient navigation. The third tier then is thinking through digital health and having the right connections at the right time to provide that information to a patient, particularly a cancer patient, so that if that's through their treatment, if that's providing electronic patient responses in the form of having them connect with their care teams through an online platform, we find that the digital ecosystem around the cancer care is evolving quickly. And the final pillar that we see a lot of cancer providers navigating is then providing patient access, patient navigation, the digital ecosystem in a way that addresses the health equity of a patient population.
What are some future challenges you see for cancer programs?
Over the next 10 years, the challenge for all cancer programs is going to be the increasing demand for services. As the population within the US ages, the prevalence of cancer is going to rise. And so there's an increasing demand for cancer services across the board. In certain communities, that demand is going to outpace oncologist supply. It's going to outpace nursing supply. It's going to outpace, even maybe the availability of cancer care in their community. And so the challenges around patient access, around navigating patients to the right resources at the right time, the challenges around providing care based on the right types of programmatic elements that will address social determinants of health is going to continue to be a need in the future. And so when we think about learning from each other, when we think about services under the ACCC, where one can share between programs, I think it's going to be valuable because we're only going to see an increasing demand for cancer services, particularly over the next 10 years.
What is it you hope that readers can take away from your article?
I would want folks to take away that your toolkit has to be more than just one type of solution, that you probably have to employ many different tactics and solutions across the board, whether that be patient navigation, whether that be a digital tool, whether that be a different type of programming in a certain community to really address the patient access challenges that many cancer centers are facing. And so I would want people to be hopeful that there are solutions out there. I would continue to urge folks to try multiple solution sets to see what works best for their cancer program and continue to push forward and really aiming towards a shorter time between patient diagnosis and patient treatment.
Thank you, Ms. Turgon. Turgon's article will run in an upcoming Oncology Issues. Until then, check out the current issue. A link to the digital journal is in your show notes. Until next time, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.